thyroid gland hormone are synthesized in thyroid gland by iodination and coupling of two molecules of tyrosine amino acid. Process is dependent on adequate amount or supplying of iodide. بالمكان اللي يقل به الايودايد شو راح يصير؟ راح يتحول الثايرويد أو الثايرويد gland إلى goiter because the less amount of iodide. Fish and soils contain iodide is the main dietary sources of iodide. Hormone take place in follicle of thyroid gland. As name is thyroid follicle. Iodide is actively picked up by thyroid gland under control of thyroid stimulating hormone. In the same time, this hormone is in the pituitary as a result of controlling of thyrotropin releasing hormone of the hypothalamus. This uptake or taking up is via sodium iodide symporter. Also is blocked, either activator or blocked. Blocked by thiocyanate or periclovate. Iodide is rapidly converted to iodine within the thyroid gland, then catalyzed by this step is catalyzed by thyroid peroxidase enzyme (TPO). Iodination of tyrosine residue in large glycoprotein, or called thyroglobulin, take place to form monoiodothyronine and diiodothyronine, which is mediated by the enzyme thyroid peroxidase (TPO). Also, this step is inhibited by carbimazole and propylthiouracil. Iodotyrosines are coupled. When coupling monoiodothyronine with diiodothyronine, this will produce T3 or triiodothyronine, while the two molecules of diiodothyronine coupled together, this will form the thyroxine hormone, or may called T4, which is stored all hormones T3, T4, and monoiodothyronine, diiodothyronine, all of them stored in a lumen of thyroid follicular cell. In normal condition, T4 concentration or quantity is more than T3, which is synthesized in states of adequate amount of iodide. When the amount is inadequate, لما الليفل مالت الايودايد قليل، ذاك الوقت شو راح يصير العكس، فيكون T3 more than T4 in the gland, in the follicular cell. Thyroid hormone is still incorporated in thyroglobulin and stored in colloids of thyroid follicle. Prior to secretion of thyroid hormone, thyroglobulin is taken up by follicular cell and T3, T4 released by the action of a proteolytic enzyme into the bloodstream. This process is stimulated by TSH and inhibited by iodide. When iodide quantity high is this process or this step is inhibited. Thyroid hormone immediately after secretion from thyroid gland bound to plasma protein. Monoiodothyronine and diiodothyronine then in this step deiodinated, and iodine is reused for second cycle. Each step is controlled by a specific enzyme. So the congenital deficiency of this enzyme, either one or many enzymes, will lead to goiter. If severe, lead to hypothyroidism. The uptake of iodide, synthesis, secretion of thyroid hormone, all of them regulated as I speak previously by TSH. About 10 times T4 form than T3. This will be in other place. The deiodination of T4 is taking place in liver, kidney, muscle. So the T3, which cycle or pathway that appear the iodine active transport into the thyroid follicular epithelial cell, iodine radical then will be then combined with thyroglobulin, then thyroglobulin iodine radical will convert into iodide. Iodide will be with thyroglobulin and in the presence of tyrosine amino acid will form MIT, mono and diiodothyronine. This by enzyme thyroid peroxidase enzyme will be formed, and after that step the coupling of MIT with DIT to form T3 and double DIT will form T4, processed then by endocytosis to form, return back to the follicular epithelial cell. This will form T3, T4 and much. This is هنشوف بالfollicular epithelial cell راح نشوف three molecules of T4 مقابلها شنو one molecule of T3 then released into the blood circulation. The protein of T3, T4 is a protein bond, so larger quantity is bound to alpha globulin as thyroxine binding globulin or thyroid binding, أو إنه 15% as transthyretin. transthyretin هو البري البومين، البيك مالته يطلع قبل الالبومين، while 10 to 15% bound to albumin. In keeping with many other hormone-free unbound fraction is physiologically active form. Also it's regulated by regulates TSH secretion. Change in the plasma concentration of binding protein alter total T3 T4 concentration but not the concentration of free hormone. مثل بقية الهرمونات أي مشكلة تصير بالسنتسس مالت البروتين الفري هرمونز ما راح يتأثر، بينما الباوند with proteins such as globulin أو transthyretin أو بري ألبومين أو الألبومين راح يكون التوتال هو affected while the free form not affected. Conversion of thyroid hormone. Some of circulating T4 deiodinated by enzyme in peripheral tissue. ما قلنا قبل سلايدين انه راح يكون بالبريفرال تيشو، بالمصل، بالكدني، بالليفر. فالتي 4 راح يتحول الى تي 3 ينزع من عنده واحد من الايودين. 80% of plasma T3 produced by removal of iodine from outer او ما نسميها بيتا رينج. بيتا رينج ايش راح تنطيني؟ اكو فارق بينها وبين الالفا رينج. من راح تروح من البيتا رينج راح ينطيني تي 3. الريمينينج 20% secreted by thyroid gland جايتني من تقريبا ثلثين بثلث جتيني من الثايرويد، بس البقية اللي هي من راح تصير من الكونفرشن تي 4 الى تي 3. deiodination of inner او ما اسميها الالفا او الانر اللي هي قريبة، هذه ايش راح تصير؟ راح تكون لي reverse T3، اسميه another name reverse T3 اللي هو inactive form of T3. T3 bind more avidly onto thyroid receptor than T4 and is the main active form اللي هو T4. conversion of T3 T4 راح يكون يتأثر قسم من الدروكس، قسم من بالحالات المرضية، قسم يعني راح تقل او تزيد. حالات اللي تقل بيها الكونفرشن مال تي 4 الى تي 3، يعني خاصة أنا بدي أحكي على الأوتر رينج أو البيتا رينج، reduced by systemic illness, prolonged fasting، لدراج اللي هي بيتا بلوكر أو أمايو دارو. نيجي increasing بواسطة منه؟ بواسطة hepatic enzyme activity اللي يسوي لي enzyme inducer such as phenytoin. Plasma T3 concentration is therefore a poor indicator of thyroid hormone secretion because it's influenced by many non-thyroidal factors and its measurement is rarely indicated except بالحالات اللي عندي thyrotoxicosis لمن زيادة اكو بالتي 3. بهالحالة يلا استفاد من الليفل مالتها. action of thyroid hormone. Thyroid hormone affect many metabolic processes. First, increasing oxygen consumption, bind to specific receptor in cell nuclei and change the expression of certain genes. Thyroid hormone are essential for normal growth, mental development, sexual maturation. Increased sensitivity. بالحالة 3 راح يكون مكمل علما، مكمل الجروث هرمون، مكمل الجونادز للاندروجين وجماعتها، والبقية الهرمونات الإفكت مالتها. 4. Increase the sensitivity of cardiovascular and central nervous system to catecholamine, thereby influencing cardiac output and heart rate. Of TSH secretion. TSH stimulates the synthesis and release of thyroid hormone from thyroid gland. Secretion of TSH, as the previous mentioned, is controlled by hypothalamic TRH and circulating concentration of thyroid hormone. TRH, pituitary TSH synthesis and release are stimulated by TRH tripeptide produced in hypothalamus and released into portal capillary plexus. هاي الترايبيبتايد هي عبارة عن pyroglutamic acid, histidine and proline amine. فإذا الترايبيبتايد مال TRH هو عبارة عن 3 amino acid. الأولى first amino acid pyroglutamic acid أو glutamate, histidine, joint histidine and joint proline amine. the action of TRH can be overridden by high circulating of free T4, and therefore exogenous TRH has a little effect on TSH secretion in hyperthyroidism. Once TRH reach the pituitary, it binds to TRH receptor, which is this receptor is defined as a members of 7 transmembrane spanning receptor family, which is act and coupled to G proteins. هاي الجي بروتين احنا بالمحاضرة الأولى مالت الهرمونز احنا حاكيها شنو معنى جي بروتين وشون الريسبتور مالتها وإلى شنو تتقسم. Effect of thyroid hormone in controlling TSH secretion. Thyroid hormone reduce TSH secretion by negative feedback mechanism. T3 bind to anterior pituitary nuclear receptor in the anterior pituitary gland. Most intracellular T3 is derived from circulating free T4. قلنا وين راح تكون بالكدني بالليفر زائدا بالمصل اللي هي يصير دي iodination of T4 حتى تنطيني ال T3. Therefore the gland is more sensitive to changes in plasma T4 than to T3 concentration. ولهذا كل ما كانت النسبة 2:3 اللي هي النسبة نورمالي راح يكون التحول peripherally يكون perfect. Thyroid hormone secretion can be made by measuring TSH as well as a free T4 or total T4, sometimes a free T3 with or total T3. وهاي يعني الحالات اللي تفيدني بها T3 هو فقط بالثايروتوكسيكوسيس. Most laboratories offer T4 اللي هي free T4 free T3 assay rather than the total. والcause هو معروف انه any changing in a protein concentration will change the level of T3 or T4. TSH concentration of TSH are high in primary hypothyroidism and low in secondary or pituitary hypothyroidism. الكل يعرفها انه من راح يكون بالجلاند اللي ينفرز من عندها راح يكون برايمري اذا بتاثير الجلاند اللي قبلها اللي هي اما الهايبوثالاموس او البيتيوتري راح تكون سكندري. In hyperthyroidism high plasma level من T4 and T3 concentration suppress the TSH from pituitary, resulting very low or undetectable plasma TSH concentration. While plasma assay of TSH are used as a first-line assay for thyroid function assessment. ليش؟ لأن هي راح تربط لي ما بين البرايمري والسكندري. البرايمري لما الثايرويد جلاند والسكندري لما بين الهايبوثالاموس والبيتيوتري. New generation assay have a high sensitivity and have a detection limit for plasma TSH. يقيس لي الميجرمنت مالته يقيس لي less than 0.1 ملي international unit per liter بالنسبة لل TSH. فلهذا تعتبر good analysis بالنسبة لل TSH حتى for detection the thyroid function test. هذا نوع من التستات أو من نوع من الكيتس يستخدموها الأساي بالنسبة لل TSH واللي تكون more sensitive. In normal individual there is a log linear relationship. log linear relationship راح تكون بينات من وبين بين ال TSH ويا الفري T4. That's to assay exponential increase in TSH concentration occur with a small incremental changes in free T4 concentration. This slide talk about plasma total and free thyroxine. Plasma thyroxine is more than 99% protein bond. Therefore, plasma total T4 assay reflect the protein bond rather than the free form. Total thyroxine reflect free thyroxine unless there are abnormality in binding to protein. قلنا بالحالات اللي تكون بها مشكلة بالليفر بالكدني حالة أما السينثيسيس أو الإكسكريشن أوف ذا بروتين ذاك الوقت يكون الديتكشن بالنسبة للتوتال يكون غير ملائم لإضافته علما للثايرويد فانكشن تيست. بحالة الان يوثايرويد ستيتس يعني الحالة اللي هي الليفل مالت التي اس اتش الثايروكسين والتي 3 كلها تكون within the normal. About a third of binding site on thyroxine binding globulin are occupied by thyroxine and remainder is unoccupied irrespective of concentration of binding protein. راح تجيني حالتين متعاكسة اللي هي hyperthyroidism hypothyroidism. الحالة الأولى اللي هي الإيوثايرويد. الحالة الثانية اللي هي hyper both التوتال زائد الفري concentration of thyroxine is increased while the number of unoccupied binding site للثايروكسين binding globulin راح يكون بها decreased. والعكس لما يكون عندي hypothyroidism راح تكون decreased بالتوتال زائدا الفري T4 while and number of unoccupied binding site راح يكون بها increase. An increase in level of thyroxine binding globulin cause an increase in both bound T4 and unoccupied binding site but no change in free T4. راح يكون الليفل مالتها فقط التأثير مالته حسب البروتين الباوند لأنه هنا تي ثايروكسين بايندينج جلوبولين هو بايندينج بالأساس فهنا ما راح يتأثر الفري قد ما يتأثر البايند الثايروكسين باوند جلوبولين زائدا الان اوكيبايد بايندينج سايت. Free T3 this total T3 or free T3 concentration may help in hyperthyroidism but aren't usually used to diagnose hypothyroidism because normal plasma concentration are very low. يعني بهالحالة قلنا بس بحالة الثايروتوكسيكوسيس راح يكون عندي مهم. الحالات الأخرى الحالات اليوثايرويد حالات لما بها الثايروكسين بها عالي التي 3 راح يكون يوزلس بالنسبة للقياس هذا بالروتين. In hyperthyroidism increase both total when free concentration is greater and usually occur in area than that of thyroxine as bound as the total or free. Occasionally in hyperthyroidism الحالة هذه راح يكون T3 سواء إذا كان free or total are elevated but not elevation in T4 or T3 T4 إذا total or free. وهاي الحالة هي مثل ما قلناها إنه هي بحالة الثايروتوكسيكوسيس. Like T4 bound to protein usually preferable to measure the plasma concentration of free than the total as the later may be altered by changing in plasma concentration of thyroxine binding أو thyroxine binding globulin. إذن همنا يتأثر ويا level of protein. بالنسبة لل TRH test thyrotropin releasing hormone. TRH is manufactured in hypothalamus and transported via the portal circulation to the pituitary where is ultimately released to exocytosis of thyrotropin stimulating hormone. TRH is a modified tripeptide synthesized as 26 kilodalton prohormone by peptide hypothalamic nuclei and transported after activation to the anterior pituitary by the portal circulation. It stimulates TSH synthesis and secretion by binding to receptor on the pituitary thyrotroph cell membranes that are linked to phospholipase C. More chronic action of TRH include stimulation of TSH subunit biosynthesis and TSH glycosylation. This is for information about TRH alone. Okay, now hypothyroidism. Hypothyroidism is caused by suboptimal circulating concentration of thyroid hormone. لما الليفل مالتهم بحالة T3 T4 يكون قليل. It becomes more prevalent with the age. أيضا حسب السكس بالومن راح يشوفها أكثر، بالأعمار اللي هي راح تكون يعني عبر 50 راح تكون 60 over 60 يكون affected ب 6% من عندهم. This condition may develop insidiously and it is in early stage الساين والسيمتومز راح تظهر شنو بشكل فيك ما معروفة، وتتداخل ويا بقية يعني اكو ساين والسيمتومز ممكن تتداخل وياها فما تبين. There is generalized slowing down of metabolism with lethargy, bradycardia, depression and weight. If hormone deficiency caused by primary disorder of thyroid gland, patient may be الويت مالته راح يقل، myopathy، menstrual disturbances بالنسبة للwomen، menorrhagia، constipation، السكين راح يكون بشكل يعني جاف، الشعر راح يكون متقصف ويوقع، الفويس راح يصير بخشونة، راح يظهر كأنه يعني maybe hoarse، و subcutaneous tissue thickening، pseudoedema، histological myxoid appearance, account for term myxedema, which is sometimes described as advanced hypothyroidism. In severe cases, common with profound hypothermia may develop. لما يكون الحالات اللي عندي كلها الساين والسيمتومز الشير إلى الهايبوثايرودism. Laboratory changes associated with hypothyroidism. أول ما يعني من أجي أقيس شنو البارامترز اللي أقيسها بالبلد حتى تساعدني بالكشف على الهايبوثايرودism. أول شيء أقيس البلازما كوليسترول concentration. بحالة الهايبو laboratory changes associated with hypothyroidism. أول ما يعني من أجي أقيس شنو البارامترز اللي أقيسها بالبلد حتى تساعدني بالكشف على الهايبوثايرودism. أول شيء أقيس البلازما كوليسترول concentration. بحالة الهايبوثايرودism the clearance of a plasma low density lipoprotein binding to cholesterol is impaired. البلازما cholesterol concentration may be moderately high. إذا عندي حالتين اللي هي متناقضة، راح يكون الليفل مال الكوليسترول عالي، وبحالة الكليرنس مال L density lipoprotein راح يكون قليل. بلازما كرياتين كاينيز هو اللي يخلي لي يصير myopathy. Activity will be raised or increased in hypothyroidism due to possible myopathy. Hypothyroidism also عنده direct effect بحالة البيتيوتري وينطيني hyperprolactinemia. البرولactin direct effect on prolactin. بالنسبة للبلازما 6 هرمون بايندينج globulin SH BG concentration is reduced ولهذا يعانون من الانفرتيلتي. A macrocytic anemia may be observed with the raised of mean corpuscular volume اللي هو MCV. بحالة السيفير hypothyroidism reduced estimated glomerular filtration rate اللي هو GFR may be occur probably due to impaired renal burden. Causes of hypothyroidism and the primary, the most common cause of hypothyroidism worldwide is iodine deficiency. In area adequate intake of iodine, acquired hypothyroidism is mainly due to autoimmune thyroiditis اللي هي Hashimoto's thyroiditis, which is more frequently seen in the women and the elderly. Maybe also be goiter hypothyroidism associated with autoimmune disease such as type 1 diabetes, adrenal insufficiency, or secondary hypothyroidism is due to low concentration of TSH or from pituitary or TRH from hypothalamus. This is less common than primary hypothyroidism. Long-standing حالة عندي long-standing secondary hypothyroidism, thyroid gland may be atrophy. This atrophy is irreversible. The essential biochemical difference between primary and secondary hypothyroidism is plasma TSH. ايش راح اشوفها؟ اشوفها بحالة البرايمري حتى افرق عن السكندري. راح اشوفها high in primary و low in secondary. ليش هاي ان برايمري؟ لانه الليفل مال الثايروكسين زائدا تراي ايودوثايرونين راح يكونوا قليل، فلهذا يشجع او يحفز البيتيوتري حتى يكون الليفل مال pathophysiology that as a primary hypothyroidism developed TSH secretion increased and as a negative feedback mechanism which is associated with falling plasma level of T4 or totally or free fall will be decreased. Asthma T3 and free, total or free may be normal and thus not usually useful in making the diagnosis. مثل ما قلنا انه الليفل مالته هو قليل. Pathophysiology generally in a primary hypothyroidism the plasma TSH concentration is high but is low in secondary due to disease in pituitary or hypothalamus. Initially, the plasma T4 or total or free may be within the population reference range, although abnormal low for the individual. اللي هو يكون قسم من عندهم راح يكون ضمن الريفرنس رينج، بس راح يكون القسم الآخر هو أقل من يعتبر أقل من الريفرنس رينج ويعتبر low. For this reason, the plasma TSH concentration is the most sensitive index of early hypothyroidism. If the patient is very ill, investigation should be deferred تؤجل. ليش؟ يعني يتأثر بالستيتس مال البيشنت بالإلنس وبال الليفل مال pregnancy and neonatal hypothyroidism. In about 23% of a pregnancy, the mother has Hashimoto's disease, thyroid hormone are essential for fetal development, for metabolism and metabolic pathway. Hence, the importance of treating the mother with a thyroid hormone resistance. In generalized thyroid hormone resistance, a plasma total and free thyroxine concentration are elevated, while the TSH either راح يكون أما هو ضمن النورمال أو راح يكون slightly raised. Some patient راح يكون appear euthyroid، راح تكون يعني الليفل مالتهم هو ضمن النورمال، but other may be present with hypothyroid symptoms and defect may be inheritance. هل inheritance شلون راح يكون؟ التايب مالته autosomal dominant trait. The defect is thought to be due to defect in T4 and or T3 receptor, may be associated with end organ states. Laboratory investigation of suspected hypothyroidism, carefully history of the patient, which drug is taken, examination of performed, checking for goiter إذا عنده ورم، إذا قبل ما أسوي التحاليل. بعدين أروح يدز الطبيب تحاليل اللي هي TSH T3 T4 اللي هي التوتال زائد الفري slightly elevated من TSH and the normal free T4 concentration suggested compensated hypothyroidism. Measuring of circulating antibodies to thyroid or useful اللي أسميها anti thyroid peroxidase enzyme اللي هي الانتيبوديز for this enzyme useful. Test should be repeated after كل 3 إلى 6 شهور as some patients may develop full-blown hypothyroidism. Suspected raised also الحالات الأخرى راح تطلع لي raised plasma TSH، لكن شنو raised وياها low level of 3 concentration suggested primary hypothyroidism, and thyroid antibodies should be measured, and if a positive other autoimmune diseases excluded. يعني بالحالة اللي تطلع لي بيها anti TPO positive ذاك الوقت أني أكنسل كل الديزيز اللي هي جايتني autoimmune disease such as rheumatoid arthritis, diabetes type 1, systemic lupus erythematosus and other. Low plasma level TSH with free T4 concentration indicate hypothyroidism caused by hypothalamic or pituitary disorder. TRH test should be done if indicated and the pituitary gland assist. Raised plasma TSH either with raised or normal plasma free T4 in the presence of hypothyroid symptoms may be indicate thyroid hormone resistance. Treatment of hypothyroidism, this is usually with T4, can be titrated until plasma TSH is within reference range. This has recently been challenged as the plasma TSH concentration may not adequately reflect tissue hypothyroidism, and it may be better to be guided by plasma free T4. Clinical and the clinical feature, thyroxine used with a caution with ischemic heart disease for fear of indirect low dose initial class beta blocker may be indicated.